So in today's video, I thought I'd talk about 3 common reasons why chiropractic doesn't work for people. These are 3 mistakes that I've seen practitioners make again and again. They're mistakes that early in my practice I actually made as well. And we'll talk about what they are, how to spot them, and what you might want to consider instead. So the first one is your chiropractor keeps doing the same thing despite it not getting the results that you're after. Now, this is a little bit tricky because, as I tell all my patients before we start care, I'm not a miracle worker. Chiropractic doesn't get instant results. Sometimes it can, but most cases, particularly the more chronic, complex cases that I tend to see in practice, care can take time. You might need several sessions before you start feeling a benefit. The changes that we're making have to happen over time and the body has to get used to it. So it's not uncommon to have a few visits with your chiropractor and not really be sure if it's making progress. That's why we always schedule a review for our patients at a point where we do want to be seeing changes, to check in and check all the tests and make sure we're on track there. But because of that, it's not uncommon for the chiropractor to see you haven't made much difference, but still do the same thing. That might just be part of what the body needs. A bit like if you go down the gym, you might be doing the same workouts a few times before you start to feel any different. However, at a certain point, you really should be starting to feel a difference. And certainly your practitioner should as well. They should be able to demonstrate to you that they are seeing some changes. And ideally, it should be something that you can feel. It shouldn't just be my chiropractor says it looks better to him, but it doesn't feel any different to me. When chiropractors keep doing the same thing and the same thing over and over, sometimes it's because they're just hoping that eventually it's going to kick in. And we're doing the same thing, if you've had like 8 or 10 visits and you're not feeling any change, particularly if your practitioner hasn't talked about reviewing or reassessing, if they haven't made any mention of if by this date we're not seeing X, then we might need to consider something else. Then you may want to get a second opinion, or at the very least ask them, could this be something else? Is there something else going on? Because if you keep doing the same things over and over, that's the definition of insanity, as the quote goes. So that's normal at the start. It's not uncommon. But certainly, after a few visits, at least you should be hearing the chiropractor saying, we're starting to notice a difference. And ideally, in most cases, you should be starting to notice something. It may not be completely gone, especially if you've had it for a while. It could take a few months sometimes to really fully resolve. But you should be able to see, and your chiropractor should be able to show you something that you can feel that shows that you're on track. So that's the first one. It's because they keep doing the same thing every time. Now, the second one, it's a little bit related to that, is your chiropractor is only looking at your spine. Now, obviously, if somebody comes to me with neck pain, they are expecting that I'm going to look at the neck. And it would be quite strange if I didn't look at their neck, given that's where the pain is coming from. However, that doesn't mean that this is the root cause. It may be they're getting neck pain because the neck is compensating for something that's happening further down the spine or out into the arm. I can't tell you how many cases I've seen of back pain where we had to treat somebody's knee, hip, even foot and ankle to actually get the back pain fully resolved as well. As chiropractors, we obviously specialize in the spine. That is what we're trained to do, and that's what we see day in, day out every day. So any chiropractor you see will be pretty familiar with treating the spine. However, not all of us have been trained to a high level to treat the arms and legs. And what that means is if you come in with neck pain and the practitioner isn't confident treating outside of the spine, they may have a tendency to just look for things in the spine. Or they might do a quick assessment of the arm, but if they don't really know what they're looking for, they might miss things. And if you have something that's going on in the arms or the legs that's driving that pain, maybe it's not the root cause, but it's adding to it, you're only going to get partial results. And no matter how much chiropractic care you get and how amazing they are at treating the spine, you'll see a problem that either doesn't ever fully go away or keeps coming back very quickly. This is particularly true if you have had your problem for a long time. I find in my experience, if somebody has a relatively new issue, if they've only had back pain for a couple of weeks, majority of time you treat the back, that's going to take care of things. But if they've had it for a long time, often, not always, but fairly often, there's something going on in the extremities, in the arms or legs that is adding to that as well. For the low back, it's more commonly the legs. For the upper neck and back, it's more commonly the arms. But it can be either with either. That is not a hard and fast rule. But there's a good percentage of my patients who have had pain for a while where we have to treat outside of the spine in order to deal with it. So if your chiropractor is only ever looking at your spine, if they're not even assessing the arms and legs, or they never treat the arms and legs, that could be one reason. And it may well be asking them, do they think this problem could be being driven by a problem elsewhere? If you're looking for a chiropractor, it's always worth assessing and finding out, are they somebody who treats arms and legs as well? Because although we will all get a lot of experience treating the spine, if we haven't trained in that, if we don't have experience treating arm and leg problems, then we might end up missing some of the other causes that aren't so obvious, because the pain isn't coming from there, but it's making the pain come from somewhere else. So that's the second one there, is that your chiropractor only treats the spine. The third one is your chiropractor thinks they can do it all. If you're seeing somebody who thinks that all you need to do is see them, but you're not getting there, it may be that you might need to see someone else. Now, I don't mean that chiropractic can't help you, but I mean you may need a combination. So many of our patients here, I co-manage with our massage therapists. So we have 4 massage therapists in-house at the clinic as well. And quite a few patients, especially again, if they've had problems for a while, will actually benefit from a combination of care. So they may come and see me, and as part of their treatment plan, I might recommend they have some sessions with the massage therapist alongside seeing me. And I will then tell the massage therapist what we found, what to work on. They will tell me what they find, because they're experts too and I want their input. So the two of us will work together. That's a pretty common way of doing it, but it might be that you need to work with somebody else. It might be you need to work with a sports therapist. We've got some highly trained Pilates instructors we work with. Might be, we need somebody else's help to get you stronger, a bit more targeted than just giving exercises to do at home. Could well be acupuncture. I've worked with a couple of acupuncturists, and I'll be honest, I don't fully understand traditional acupuncture theory. I'm not entirely sure how it works, but I've seen for certain cases with particular characteristics, it can work really well. And again, that doesn't mean I send them off to the acupuncturist and say, I hope they can help you. It may well mean that we co-manage. I had one patient of mine who had seen another chiropractor in the past and had had a few weeks of treatment, and it didn't get anywhere. It didn't make any difference for them at all. Came back and saw me, and I said, look, there's definitely some things to do, and in terms of treatment, I would probably have started treating you similar to them. However, I've got the benefit of their experience, knowing that treatment didn't work on its own. So we had a look at it, and we realized that actually for her, there's a lot of tension bound up in the system. She was somebody who I said, look, you will probably respond well to acupuncture. Referred her to a local acupuncturist who's a specialist that I've worked with. Very quickly, she started to feel things loosening out. And then when she came in, the chiropractic treatment started working better. I started getting things to move that didn't want to move before, because she actually did the acupuncture to just get the system to relax. That allowed me to get in it and get the joints moving. And in fact, in her case, she benefited from the occasional massage as well. So sometimes it might be 3 people that you see at different times. Now, she's not seeing 3 people every week or anything like that. It doesn't have to be incredibly intensive, spending lots and lots of money every week. But seeing people in the right order and seeing different practitioners, that's what was needed to get her spine to really relax and to get her feeling much better. And in all honesty, any one of them on their own probably wouldn't have been enough. So if you're working with a chiropractor who, again, they're not getting you the results. And by the way, this goes for physios and osteos and everybody else. I'm not just banging on chiropractors here. It's just I know chiropractic really well. I know how we think. But if you feel like you've only been getting so far and it hasn't been getting you the results they've hoped, and there doesn't seem to be much more of an option, that maybe they've tried treating the arms and legs and that's not it. They've tried different things, but that's not it. It may well be that you need to see somebody else. You might need somebody else added to your team. The types of cases we see in our clinic, often we need to build a little bit of a team. Not lots, but it may be another practitioner or a couple. And actually them working together, the collaboration, can be what works really, really well. So that's something to think about. If you're seeing a chiropractor or another practitioner, you're not getting the results and you're getting frustrated, you don't know if you should just wait it out or not, have a think and go, are they just doing the same thing every time? Are they trying to adapt it? Are they trying different things? Are they looking beyond the site of the pain? Are they looking further out from the body? If it's a spinal issue, are they looking at the arms and legs? And do they ever consider co-managing with somebody? Is it potentially worth asking them, is it worth me seeing somebody else as well as you, or trying something different, rather than a practitioner who thinks that they can do it all by themselves? Because as chiropractors, we're excellent at certain things. We're okay at a few things. We can't be experts at absolutely everything. So have a think about that. As always, if you have any questions on this, just reply, get in touch with the clinic. We'd be happy to chat.